Well, good afternoon, everybody. I'm Don Clavin, Town of Hempstead Supervisor. I'm joined by our medical director here in the town, Dr. David Neubert, and of course, Councilman Anthony D'Esposito. With everything going on, we're trying to find ways to reach out to answer questions and alleviate concerns of residents. And by utilizing this Facebook town hall, we're hoping to accomplish that. Obviously, things change every single day. Procedures are being incorporated, but I want everybody to, I understand that people are stressed out. People, of course, are, have so many anxiety, so many questions, and we all do. We're all human. And the idea is, we want residents to remain calm. We want you to be prepared. We want you to, have everything in place and be at ease. But we're also human beings, and that's part of the process here today. Is trying to alleviate some of those concerns. I do want everybody to know that essential services in the town of Hempstead will continue. Sanitation, water, and on a limited basis, some of the others. But the essentials will continue even with the restrictions the governor has put in place. And I want everybody to be rest assured about that. Perhaps we can start off with a little bit of an update from our Director of Medical Services right here in the town of Hempstead, Dr. Neubert. Doctor?
Thank you. Appreciate it, Supervisor. Good afternoon, everybody. From the last time we talked, you guys probably have noticed that social distancing has become the latest buzzword. It's actually now on the signs over the highways, thanks apparently to the DOT. But the reason that they're doing that, guys, is this is extremely, extremely important. We are at a crossroads right now that we have the ability to slow the spread of this virus and return our lives to normal, hopefully sooner rather than later. This is a point in time where you guys should not panic, just like the supervisor said, but it's extremely, extremely important that you heed all of the warnings that physicians like myself and other doctors and the health departments and the state health department, you need to listen what we're telling you, okay? Stay at home, do not travel if you don't have to, maintain social distancing, do all the stuff that we talked about the last time we chatted where you're washing your hands, hand sanitizer, very, very important. That you're not touching your face or your eyes or your nose. We have, endemic spread or pandemic spread of, in the community of coronavirus right now, and we want to stop it from spreading to person. The faster we can stop the spread of this disease, the faster we can all go back to our normal lives. So we want to make sure, that we take care of our friends and we take care of our neighbors and we take care of our family members. And you do that by listening to what we're talking about, by doing the social distancing, by staying home. So do not go out. We've been having a lot of people go to our parks, and we have very nice parks, but that is not social distancing if you are out and you're in large groups. You should not be in any groups greater than 10 people. That's the recommendation from the CDC. That is our recommendation. The smaller the groups, the better. The more distance that you keep between each of us, while it seems odd in a social capability, it is better. We must follow these instructions because then we can slow the spread of the virus, allow our systems to catch up, allow our hospitals to function, allow emergency services to continue operating at full capacity, and as the supervisor said, we'll keep the essential functions of the town moving, and then we'll have some inconvenience for a short period of time, and then we'll be able to return. If we don't do these things now, guys, then what's going to happen is it's going to look like Italy, where they didn't heed the warnings, and now they have just mass disruption of their lives with no end currently in sight, and none of us want to get there. So do what's right for yourself, do what's right for your family, do what's right for your society, and follow the warnings that we're giving you. No need to panic. Most people are not going to get sick, but we need to, as a society, make sure that we all stay healthy, and that's the really important thing that we need to get out to everybody. So back to you.
Well, Councilman, do you want to add anything?
Oh, sorry.
I just really want to say thank you to our CSEA workforce, Dr. Dave, and our emergency medical staff. The work that they've been doing is second to none, and I know that our CSEA workforce is always out there doing the best they can to move the town of Hempstead forward. But in these times, it's not easy. It's not easy keeping the social distance, and it's not easy while we're all concerned about taking care of our families at home. But I really just want to say thank you to all of those who are assisting in keeping the town of Hempstead moving forward, making sure that the services that we provide are still provided, all while trying to keep everyone safe and healthy.
Yeah. Absolutely. Our co-workers have been amazing here, and we've tried to the best of our ability to keep services flowing. With the governor's new restrictions he is imposing effect on Sunday, it will further reduce our ability to provide some of the one-on-one meetings, but we will have limited public access to town hall from 10 to 2 with a lot of phone call follow-up to residents. But again, when it comes to those essential services, water, sanitation, those will continue and residents should rest easy. And most importantly, your governments are working together. The federal level, I salute the governor of the state and the county executive have all been teaming up, and the other town supervisors communicating so we can all be on the same page and have operations moving forward.
And just to that, the supervisor said, I just have to do a shout out to Dr. Larry Eisenstein and the Nassau County Health Department. I have been there almost every day. Andy Simone, who's their director, I literally have been there every day, and they are giving us all the guidelines, and I'm coordinating our town response with them to make sure that we are doing what's right for our staff, what's right for our employees, and what's right for all of our citizens. And they have just, the cooperation that we have had with them has just been absolutely the best cooperation between government that you could look for, especially during a pandemic. Their help has been second to none, and they have been extremely fortunate to have them as a resource throughout this. So just we want to put that out there that we're making sure that we work with everyone to get this done for you.
We do get a lot of questions about testing.
Yes.
Maybe you can give the residents an update of what testing, how you get tested, if you need to be tested. Why don't you explain to residents?
Certainly. So everyone knows we are having additional increase in the number of tests available. Currently, the best option if you want to get tested is to go through the state's website. We will have the phone number up on the Town of Hempstead website. It's a toll-free number that will be available for us. You can also look it up on the state's website. But if you call that toll-free number, that will allow you to get access to an operator, and they will prioritize you to get tests. There are tests available at the hospitals. There are tests available at some urgent cares. There are tests available at primary care doc offices. What's really important is that we keep those tests right now for our most sick and our most vulnerable. If you are having just some mild symptoms and you don't feel well, but it's just you feel like you're a little punky and a little cold, you stay at home. And you don't need to be tested. Like any other virus, it's going to run its course. The people that we need to be tested are the ones that are really sick, the ones that are symptomatic, or the ones that are high risk. The ones with diabetes, with high blood pressure, with heart problems, with respiratory problems, the immune suppressed. It's important that the folks that are high risk, that we save the tests for them, and the folks that are low risk, if you're having mild symptoms, that you just stay at home and stop the spread of the virus. It's very important that you guys do that, because that way we know that the tests are available for those that need it, and then that we're able to keep that for everybody. There will be more tests available. The number of tests will continue to increase. So it's important that we work together, and as a society, we keep the tests for the ones that we need, and as they open up more tests, then obviously our goal is to get everyone tested. So that's something that, and I can tell you that our Emergency Medical Operations Center that we've had set up out of our Coronavirus Task Force, that has been our #1 priority from day one, is finding how to get access to those tests. And we'll continue to update that information for everybody on the website, and we'll make sure that you guys have that information, so that way everyone that wants to get tested, we'll make sure you have the info on how to do that.
Some people have expressed some questions about, they hear about quarantining. Can you explain to people what exactly self-quarantining means?
Certainly, Supervisor. So basically, a quarantine means that we want somebody that is sick to stay at home. There's something called isolation. If you get a test and your test comes up positive, you will receive a call from the Department of Health, and they will tell you that you must be isolated at home. Anyone with a positive test and a known case of coronavirus, it's very, very important that they stay at home and that they do not come in contact with others, because we do not want that virus to spread. So those are patients that need to be on home isolation unless they need to be at a hospital. Quarantine is for the direct contacts of someone that's under isolation. And the reason that you do that is the direct contacts are the ones that risk the spread of disease onto other people. So the rules that direct contact would be if you do a handshake, if you hug or kiss somebody, if you eat next to somebody. Eating is considered direct contact in close proximity, and if somebody were to sneeze or cough on you. Also, it would be within a radius of about 6 feet, and that would be for around 10 minutes. It's not casual contact, guys. It is clearly spread by intimate or direct contact where you're very close to somebody for a period of time, or you're directly in contact with somebody. That is why we're doing the self-isolation, that's why we're doing the social distancing. We isolate the people that are sick, but why we're also doing the social distancing with those that we don't know are sick. Because if you keep that distance, it stops the spread of the virus. If you wash your hands, it stops the spread of the virus. If you don't touch your face, eyes, or mouth, it stops the spread of the virus. And the faster we stop it, the faster we can go back to our normal lives. It is okay if you want to, on your own, if you're concerned, stay at home. That is the best answer. The health department reaches out and contacts the folks that have positive tests and the folks that need to be quarantined. That is a call that will come from the health department. So that's a little bit different if you get an order from the health department, but you don't need an order from the health department in order to do the right thing. If you're sick, stay home. If you hear that someone you know had a positive test, stay home. That is the best way that we can do this and the best way that we can stop the spread.
Great. And
Doc, one of the questions that just popped up, people are concerned about obviously, receiving mail, their newspaper delivery, and they're asking, do they need to wipe them down with Lysol or leave them outside for a certain amount of time? Could either one of those things cause them harm?
So that's a good question, Councilman. I forgot we were. So that's a good question. So, the question about whether this can live on surfaces. There are some studies that do show that it can stay on surfaces. A surface like this, which they wiped down before we were sitting here, a hard surface, a hard plastic surface, is most likely the one that the virus is going to stay the longest on. On some cardboard, it does seem that it does stay for up to 24 to 48 hours on some cardboard surfaces, depending on the environment. But again, this is, I think we had this question last time we did this, can you get boxes from Amazon or something? So the same thing with your mail. I mean, I can assure you that most of the time in the post office, they're wearing gloves when they're handling this stuff, just because they did that even before the virus. But the odds that there's enough of the virus on the surface of a mail or an envelope or a box is very low. The best thing you can do if you're concerned is just to be outside your house, or be in, say, your garage, or be in like a foyer, somewhere away from your normal living areas. So you're not in your kitchen, you're not in your living room, you're not in your bedroom. So somewhere where you don't do your normal activities of daily living. Open your boxes there, open your mail there, then immediately throw out the envelope or the box that was there, wash your hands really, really well, and then do your usual social distancing and not touching your face. In that way, you will not bring anything into your house, and your house will stay clean. There's no reason that you should not order takeout, not order, if they're still allowed to be driving. You shouldn't order boxes, you shouldn't order stuff, especially if we're all going to be at home. Mail and delivery becomes even more important. So do not isolate yourself in that way. It's important that those functions continue, and the chance of you getting anything from that is extremely low.
We've got a lot of questions, particularly from seniors. Many of you know we have 14 senior centers here in the town of Hempstead. Unfortunately, for health reasons, we've had to close them. We are still providing meals to our seniors. We provide over 300 a week to our seniors, and that's an essential part. We're going to continue that. But some people are asking, do you have any explicit advice for what seems to be the most vulnerable in this time, which are senior centers? Precautions, things they should try and avoid. Do you have any extra words of advice for that?
Yeah, certainly, Supervisor. So the first thing that I would say is, even though we're social distancing and we're not able to be touching, that does not mean that we should be isolated from our friends, from our family members, from our neighbors, and from our colleagues. This is a perfect example. I've had so many people reach out to me recently, ask me how I'm doing, asking me if I'm getting food, asking me if I'm getting sleep. It's actually very sweet. for the people that are doing that. Thank you. So, just like people are checking in on me, it is important that you recognize and identify if you have a neighbor that you know is elderly, or your grandmother or your family. This is the time that we all need to reach out. We're all obsessed with social media, more than ever. But this would be the time to be not just locked on your social media phone, but actually phone calling people, checking in on them, making sure, because then you could reach out to your seniors, and if they feel uncomfortable leaving the house, then you can help get them services. You can, it's important for seniors. You can still go outside. You can still walk around your backyard. Even though we're doing this social distancing, don't just sit inside. We don't want people congregating in public areas, but we also don't want people to completely give up their lives, because then they'll have problems with depression and other psychological issues. So the best thing I could say for the seniors, if you know one, reach out to them, make sure they're doing okay. If you're a senior, you still want to be up. You still want to be walking around. You still want to be eating healthy. You want to make sure that somebody's getting you the medications that you need, and you also want to make sure that you're just keeping up on maybe just check in with your doctor in case you have any questions. It's important that you don't really go to previously our seniors would have gone to a doctor's appointment. Now it's better for them to just probably call the doctor's office. But that's the kind of thing that we need to do to make sure that they're safe. Also, so you guys are aware, all of the seniors that are in town of Hempstead housing developments that the town helps to manage. Our senior enrichment program and their commissioner and deputy commissioner have been wonderful, and they're working with one of our EMTs, and they are constantly calling and checking on them, making sure that they have the resources that they need, making sure to give them tips on how to stay healthy. And they're also ensuring that if anyone has any medical questions, that our EMS staff is available by phone to answer those questions, or we also do have EMTs that can actually go out and do welfare checks if we feel that is necessary. So we are ensuring that before, our senior centers served as a way to connect these seniors and make sure that we were keeping them safe and keeping an eye on them. So we're now working on bringing those services out to them to be sure that we're doing that for them. So that's very important that we're doing that, keeping an eye on them.
So Dr. Dave, I think one of the things that the supervisor and I and all our colleagues on the town board, whether you represent the 5 towns or Levittown or Seaford, Wantagh, or to the west end of town, one of the biggest concerns that we've seen is our local economy, local business, and there has been talk, and it's on social media, and people are reaching out to really support and try to support local businesses, whether it's your local restaurant or your local pub that's now doing takeout and delivery. It's a way to kind of get out, spend some money, and try to keep those local businesses, afloat as much as we can. So one of the questions here is it safe to get takeout or delivery? Shouldn't the people be staying home?
Okay, so it is safe to get takeout or delivery, and just like you said, Councilman, it is very important that again, back to, we all need to be taking care of each other. This is the time, just like after Hurricane Sandy, when we all got together as a community and we helped each other out. This is our new Sandy. It's just a very different pandemic version of Sandy. But what we need to do is make sure that we're supporting our neighbors, supporting our friends, supporting our local business. You can get takeout. If you feel uncomfortable seeing the person face to face, it's okay to ask if they could just leave it at the door, and then you could do like a no contact pickup of that food. I can assure you that any place currently that is doing takeout, I'm sure they are very mindful of the precautions, wearing gloves. They probably are wearing masks in the area where they're preparing your food. And if you have concerns when it comes, you could always, again, take the containers that the food comes in and then just use it in one place, like in the bag that they bring it with, and move it to one of your plates and then reheat it in your microwave. This is still a developing situation. We are not, as physicians, 100% sure if there is a way of spreading this by food. There actually are sometimes that you can get, some GI symptoms, some stomach virus type symptoms from this virus, but we're still unsure if that's from entry here or if that's from taking it, just swallowing the virus. It's still a developing situation, and so there's no reason that we can definitively say that not eating, eating takeout is bad, and since we don't have any, any evidence that that's dangerous, and it's important that people have access to food and have access to services, and our businesses and our country continue, you go ahead and you keep doing these things and you don't worry. I had takeout last night. When I leave here, I actually am going to get a frozen yogurt at my favorite yogurt place in Garden City at the TCBY I mentioned last time. So I am still eating out business. I'm still getting my Starbucks. I'm still, I'm still getting food from local businesses. So, if I'm doing that for myself, I would rest assured that I don't think getting coronavirus for myself is something that I'm looking forward to. So I can recommend that is okay for you guys.
As a reminder, maybe you could give everybody, there are a couple things going on. You could have symptomatic of coronavirus. Some people also might be experiencing regular flu. And now that we're getting into the allergy season, that is something that we seem to get a lot of questions of. Maybe you can just give some of the symptoms again for coronavirus that should really be the red flag that, this is when you should be concerned about these symptoms in particular.
Of course. So, the interesting thing and the thing that has made this virus so challenging for physicians like myself that are on the front lines in helping to stop the spread and to help people is that it has many different ways that coronavirus can present. Initially, we were told that it's fever and a cough. But now it looks like it's not just fever and a cough. And as I mentioned, sometimes it can be more like a stomach virus and cause abdominal pain and diarrhea. So, the symptoms, and as the supervisor said, it's very difficult because this has also still been a very bad flu season. And also, regular colds are still in the community as well, rhinovirus, adenovirus. So there are lots of viruses that are active at this point in time. Again, back to the testing point. It's important that we get the very sick people tested because we need to make sure we're testing them, that we're treating them correctly. There are some new treatments that are coming out now, some new medications, which actually are old medications that used to be used to treat malaria, that look like they may have access or they may have treatment for coronavirus. Obviously, if we know somebody has the flu, we have treatments for that. So if you're young, and you're otherwise healthy, and you're having flu-like symptoms, or you're having symptoms of a mild stomach bug, and you otherwise feel fine, best thing for you to do is stay home. As long as you are not having any symptoms of concern, you're not having a high fever, you're not in terrible pain, you're breathing okay, you're able to tolerate fluids, and you're drinking, and you otherwise feel okay, just stay at home till you feel better, let it run its course. Typically what they're saying now is that from the time you develop symptoms to the time you should no longer be able to spread the virus is about a period of about 7 days, and it should be about 72 hours after the last time you have a fever. So if you develop those symptoms, you want to wait 7 days till after you feel better, and you want to wait 72 hours after you have a fever, and at that point, you no longer can spread the virus to anybody, and you can go about your daily business. So if you can handle this at home, and you are not in danger, you should not go out to spread this. You should not go to a doctor's office and spread this. You should not go to a hospital and do not request a test because you're using up resources that we need for the sickest. That is the most important thing right now. And again, that's back to the social justice and the social fabric that, if you're okay and you're not in danger, then don't use up limited resources that we have. We want to save those resources for the very sick people that end up on ventilators or end up in the hospital, because then we'll know specifically how to treat those people. And now we're actually developing treatments for that. Obviously, if you're having trouble breathing, if you're having a high fever, if you're having problems where you feel like it's unsafe for you to be at home, then definitely access emergency services and go to the hospital. But it's we don't need to know. You don't need a test in order to get better. More than 90% of the people that get this get better on their own. The test does not make you, the test psychologically might make you feel better, but does not physically make you better. That is necessary for us to treat the very sick and figure out. So that's the important thing.
So Dr. Neubert, I think one of the questions that we've probably all heard more times than we can count at this point is, the first is, how long is this going to last? Now, I don't think any of us have the answer for that, but I think we could, assure those listening at home that, our first responders, our medical personnel, hospitals, government, everyone is really doing everything that they possibly can to, limit the spread of the virus, to contain the virus, and to treat those who are suffering from it. But I think it's sort of a two-part question. First is, how long is this going to last? Which again, I don't think we have an answer to. But I think something important to focus on, which is something that you kind of mentioned already, is that those at home need to understand that. I know everyone's kind of on high alert, but just because you have a runny nose or you cough by accident doesn't mean that you have the coronavirus.
That's correct.
It is the allergy season. Sinuses are rough.
My allergies are driving me
It's a
crazy.
terrible flu season,
Yes.
like you mentioned. So I guess if you could just talk quickly about the idea that everyone is doing everything they can to make sure that we contain this, and that people need to really understand that just if they're not feeling good and you don't have the symptoms of the coronavirus, then you shouldn't be utilizing the resources that could go to those who are really suffering.
Yeah, and that's very true. Councilman, like you were saying, the first part of your question, we don't want this to last any longer than it has to. Realistically, we're still seeing that curve that we had talked about, that the flattening of the curve. So any pandemic, you'll have a response where you get lots and lots and lots and lots of cases, and then it will even off at some point, and then it comes back down, and then that's when life returns back to normal. If we can make it so it doesn't go this high and it goes like this, then we know that it's going to happen sooner, that it's going to go down. The problem and the reason it's hard to answer your question is this depends on everyone playing their part. This might be the one time, more than any time. We teach Narcan together, and we always talk about having civilian responders and how important it is for civilians to help the professional and our volunteer emergency services to do their job. This might be the calling for all of our civilians. Every single one of you is now our civilian first responder and have to do the things we're asking. If you guys play your role to help stop the spread, emergency services will continue, the government will continue regardless, but we'll make it easier, and then we can stop the spread and slow it down. So if everyone does their part, then this will be a lot shorter than if everyone doesn't. This is not a vacation. This is not spring break. This is not a time to hang out with your friends outside. This is a time to heed what we're saying, to go inside, social distance, don't go out unless you have to, and then our emergency services will continue to do the very good job they do every day, but it won't be harder on us. You won't have more virus draining more resources, and like you said, if you feel fine at home, the normal reaction is I must go to the doctor right away, but this is the time that if you just have symptoms, mild symptoms of anything, stay at home till you feel better, and don't use up resources that are being rapidly, that's where the problem lies with this virus. And this is the problem where, we talked last time in our webinar about, flu kills 20,000 plus people a year. Hopefully we're not going to have anything near this with this pandemic, but it's the number of people getting sick and as rapidly as they're getting sick, and the resources we need wearing those, full gown and glove and body, spacesuits in order to protect ourselves as first responders, in order to take care of you, that if the more of the virus that we have, the more resources get used up, and then our resources become low, and then we can't care for anybody. So that's why we have to work together. And just really quick too, if you guys call 911, or if you go to the hospital and you see medical professionals in gowns or Tyvek suits and masks and goggles, we care very much about you. We're not trying to scare you. But if you do not have first responders, you don't have fire chiefs and police officers and doctors and EMTs and firefighters and all of the and the doctors and nurses and all of the people and the PAs and NPs and the urgent cares and all of these people in our medical system and anyone else I forgot to mention. If you don't let us protect ourselves, then we can't help you. So we are very mindful that it's very odd to walk in and have someone gowned up like that, but it's important to keep us safe and to keep you guys safe. So don't be alarmed by that.
Thank you, Doctor. Again, I want to thank you for taking the time. I know you're busy between everything you're doing, and I am, as well as Anthony and the entire town board. And anybody watching is very appreciative taking the time. We plan to do another update later this week. We will ask residents to monitor the town Twitter, Facebook, social accounts, letting them know when our next update will be.
I have the phone number too for the Jones Beach thing.
And if you have the phone number right now for the Jones Beach facility?
Yeah, so everybody, the phone number for the Jones Beach testing site that's operating right now at the state is 888-364-3065. Again, that number is 888-364-3065. 3065. For our neighbors on Long Island, that is the Jones Beach test site being run by the New York State Department of Health. We are not, we're not directly affiliated, but that is the the easiest way. If somebody needs a test and they're not in a hospital to get a test, you call that number. You'll be on hold for a while, but the state is prioritizing those and doing the best they can, and the state has been doing an awesome job. We were down there a few days ago, and I have to say that their setup is very impressive, and they're doing a really good job down there. So that way you have that information, and that number will also be up on the town's website as well.
Great. Yeah, like I said, we're asking most residents, if you can, don't come down to Town Hall. You can dial 516-489-5000. We can answer your calls. We're taking intake sheets to follow up with questions or paperwork that can be sent to you. And I have to stress to everybody, please adhere to the directives, the advice that are coming at the federal and the state level. This is being done to protect us as a society as a whole. I know some people say, why do we have to do this? Or, this is such a hassle. Don't look at it that way, ladies and gentlemen. Look at it that we are at a level that we need to. And these precautions will save lives. Again, Councilman D'Esposito, any last minute thoughts here?
Just, I encourage everyone to stay safe, stay healthy, and just know that Don and I and our colleagues on the town board, Senior Councilwoman Gooseby, Councilman Blakeman, Councilman Dunn, Councilman Muscarella, and Councilman Carini are working as hard as we possibly can to keep everyone safe, keep everyone healthy, and a sincere thanks to our CSEA workforce for the job that they're doing.
Absolutely. Doctor, any last minute thoughts here?
Now, just again, everybody, don't panic. We're going to work together. We're going to get through this together like we get through everything else, and just know that there's a whole team of people that are working behind the scenes to make sure that you're healthy, that our workers stay healthy, that the government keeps running, and that emergency services continue. So just do your part. We'll do our part, and together we'll make this work. And down the line, once this is over, we'll have stories about the crazy pandemic of 2020. But for right now, we're going to buckle down. We're going to do the right thing. We're going to help each other out, and we'll get through this together.
Doctor, thank you very much, and thank you for your great, I always tease you, you got a wonderful disposition that really calms people. And I hope this is beneficial to all of you at home or at work or on your phone that are looking at it. Again, we will be having another one later this week. We'll pass along that information. Be safe, be careful, and be smart. Listen to what the advisories are and follow the recommendations, and we will all get through this together. Thank you all, and have a wonderful and safe afternoon.